No more common eyes disease. Common eye conditions. 1. Dry eyes. Dry eyes occur when your eyes don't produce enough tears to stay moist, or when your tears don't work properly. It can make your eyes feel uncomfortable, and in some cases, it can cause vision problems. Dry eyes are common, it affects millions of Americans each year. 2. Cataracts, are dense, cloudy areas that form in the lens of your eye. A cataract starts when proteins in the eye form clumps that prevent the lens from sending clear images to the retina. It develops slowly and eventually interferes with your vision. You may end up with cataracts in both eyes, but they don't usually form at the same time. Cataracts are common in older people. More than half of Americans have cataracts or have had cataract surgery by the time they are 80 years old. 3. Glaucoma. It is caused by the degeneration of the optic nerve, which may eventually lead to loss of vision. In most cases, the intraocular pressure is increased. Symptoms that can be observed include eye pain, blurred vision, and visible halos in patients with acute glaucoma. It may also be accompanied by headaches, nausea, and vomiting because the intraocular pressure is too high. Many patients do not have any symptoms. Acute glaucoma is more common in Asians, and the proportion of young people, such as those in their 30s, suffering from the disease has been increasing in recent years. 4. Floaters. Floaters are small black shapes that float in your field of vision. They look like spots, lines, squiggles, or even tiny spider webs. Most people have floaters that come and go, and they usually don't need treatment. But sometimes floaters can be a sign of a more serious eye disease. 5. Macular degeneration. Age-related macular degeneration, AMD, is an eye disease that can blur your central vision. This condition occurs when aging causes damage to the macula, the part of the eye that controls sharp, straight-ahead vision. The macula is part of the retina, the light-sensitive tissue at the back of the eye. AMD is a common disease, it is the leading cause of vision loss in older people. AMD does not cause complete blindness, but loss of central vision can make it more difficult to see faces, read, drive a car, or do close-up tasks such as cooking or fixing things around the house. 6. Retinal detachment. Retinal detachment describes an emergency in which a thin layer of tissue at the back of the eye, the retina, pulls away from its normal position. Retinal detachment separates the retinal cells from the layer of blood vessels that supply oxygen and nutrients. The longer a retinal detachment goes untreated, the greater the risk of permanent vision loss in the affected eye. 7. Diabetic retinopathy is an eye disease that can lead to vision loss and blindness in people with diabetes. It affects the blood vessels in the retina, the light-sensitive tissue layer at the back of the eye. If you have diabetes, it is important to have a comprehensive dilated eye exam at least once a year. 8. In addition, individuals of different ages may have different eye diseases, such as vision problems, strabismus, amblyopia in children, or visual fatigue, dry eyes or abnormal vision in school age and working age groups, and presbyopia in people over 40 years old.